Hi, thanks for joining. Please make sure you subscribe to follow us on all the various platforms here on the podcast, as well as on YouTube. The stuff we write on Substack, as well as quick takes on Instagram and on Threads. If you're enjoying what we're putting out there, please make sure you're sharing with all your friends and family. And if you have questions or comments about the stuff we're putting out there, please make sure you leave them in comments to us. We'd be more than happy to cover them in future talks. They probe, they propagate, they foment the need to have a debate about topics in science where the answers appear to be clear. Actions is a powerful few centered on an ideology that they label Make America Healthy Again, MAHA, whose intentions do not match their action. That led to the question, how much political power should influence scientific agenda? How much political power should influence scientific agencies? Well, let's talk about that.
Warning. The following presentation contains information that might contradict what you have previously heard, or believed to be true, about how the human body works, and contains material that is not suitable for closed-minded individuals. Enjoy!
Why is it problematic that RFK Jr. and the MAHA initiative is forcing the CDC to comply with theirs and the current administration's viewpoints regarding public health, and why everyone should be worried if we can't stop it? In an era where we get a constant encouragement to do our own research. Do our own research when it comes to our health. Utilize artificial intelligence to provide answers and information about how to exercise, how to diet, and all the other avenues of lifestyle interventions meant to make us healthier. We need to become ever more reliant on good sources of information that come from ethical and reputable scientists. Ethical and reputable scientists that can provide insights into claims of uncertainties that surround how we can prevent chronic diseases, or what can happen once you become sick from an infectious disease, or how to prevent sickness from infectious diseases. Instead of getting this, we get actions of the vocal, powerful few that propagate a debate about the safety of vaccines, or the need for physicians to learn about nutrition, or elimination of synthetic dyes, all while stoking a polarized public trust in national health institutions. We've implicitly seen in the past what happens when we have this politicalization of our health agencies. In the 1980s with HIV, when it comes to women's health and women's reproductive health, recently, when we start looking at the recommendations that have been put forth during the peak of the COVID-19 pandemic. But it has not taken the overt efforts that we see currently, particularly in the last few weeks, at the Centers for Disease Control and Prevention, the CDC, and the need for them to succumb to the will of one man, RFK Jr., and the extreme biased point of view that the proponents like to call MAHA, Make America Healthy Again. For more than a century and a half, the CDC has been regarded as the nation's, but also the world's premier public health agency, tasked with delivering impartial, science-based guidance to protect both domestic and global populations. Yet we are facing a time where a single political leader with limited scientific credentials and a controversial reputation on science and medicine is attempting to coerce and compel the CDC towards a partisan agenda. A point that needs to be explored, as this form of interference matters, regardless of one's political leanings, as it singles a more overt campaign of action to undermine the scientific understandings about health and the evidence of best practices that have been integral and have become integral to healthcare, if not as a stand-in for a broader statement about the current state of relationship between political desires and scientific knowledge within the United States. The developing controversy that surrounds the efforts to comply with the current administration's and the MAHA narrative about vaccine safety, food additives, and diet and nutrition exemplifies the collision between political power and public health integrity. Actions that are problematic for several reasons. While many pundits will discuss this as an effort to undermine public trust, it is more than just that. The implications are directly in line with the do your own research and the implicit biases projected by RFK Jr. and the MAHA social media experts the MAHA social media health scientists, the social media health scientists, the social media health experts, put quotes around all of the experts, all of the scientists in terms of the labels, as it sets out to undermine scientific authority and expertise. To be clear, while this is coming from a conservative political administration, the talking points, the pseudoscientific approaches, the biases, and the biased projections are not contained within one political wing or another. It is not a conservative or a liberal thing. It is not a socialist or a libertarian thing. It's an issue. It's an issue with the impetus of action where we have to align guidelines and publications with the biases and with the actions that are overtly compromising the independence of health experts and health science research. It also has the direct unintended consequences for potentially endangering lives worldwide, as we will most likely begin seeing policy decisions that are being made to prioritize appeasing the psyches of those in power by echoing their biases about health over the empirically tested and objectively validated approaches. This is why we need an independent arbiter for public health. This is why we need the CDC. This is why the CDC was founded. It was not to be used as a tool for partisan battle, but as a neutral institution, with decision and guidance being offered off of objective, validated evidence. Its mandate is not to validate talking points of a politician, but to collect data, to analyze health threats, and to advise the government and the public, and to implement disease prevention programs. When the public hears from the CDC, they expect that the information is the product of rigorous peer review and internal deliberation amongst scientists and health experts, not products of a politician's worldview. If RFK Jr., an individual already known for skepticism about vaccines and a conspiracy-tinged rhetoric on public health, is forcing the CDC to comply with the ideology of MAHA and the current administration's positions, then the agency's independence is eroded. Independence is crucial because health crises rarely align with the political timelines. Viruses do not respect election cycles. Public health emergencies do not wait for an administration's approval ratings to improve. The actions to politicize science are not new. Yet it is not the scientists that politicize the science. It is those who wish to discredit or undermine the science, where they will apply their political slant to either gain some slight or impugn the science as being political for showing an alternative view to their bias. Actions taken by political leaders, those with a political agenda, or those with a social platform that intend to shift social viewpoints have been using this to manipulate and massage points of view. They are manipulating and massaging data to fit narrow narratives, to fit narrow viewpoints. We have seen this for the last 50 years when discussing the outbreak of HIV in the 1980s. We have seen this with discussions about women's reproductive health care, but most recently with vaccines and vaccination recommendations and vaccination schedules. The current administration was often criticized for attempting to manipulate or pressure the CDC to conform to its political messaging during the COVID-19 pandemic. Reports surface of speech alterations, data suppression, and pressure to downplay severity of outbreaks. If RFK Jr. is actively compelling the CDC to reinforce the MAHA perspective that is ingrained into the current administration's point of view, this signals a continuation of such distortions. Public health then becomes the pawn of the ideological battles rather than the shield for all citizens. Once political actors decide that science must match their preferred worldview, the incentive to twist facts becomes irresistible. The trouble is something that most people have seen coming since the 2024 presidential campaign, with comments from the current president that RFK Jr. would have the freedom to do what he wanted with the health agencies. Actions that led to concerns being raised by mainstream scientific and health organizations, by most health scientists, not only during the campaign, but also during the confirmation process for RFK Jr. as RFK Jr. has gained notoriety for his long-standing opposition to vaccination policies and his promotion for long-debunked claims about vaccine safety. Stances that have led to the entrenched communities within the anti-vax communities and other subcultures contained within and under the umbrella of the MAHA movement to move into the sphere of the MAGA sphere that is the current administration. Allowing an individual with such a record to exert undue influence on the CDC is troubling on multiple levels. First, it blurs the line between credible public health guidance and fringe skepticism that often circulates online within the conspiracy theories. Second, it risks turning the CDC into a propaganda outlet rather than a trusted source of unbiased scientific evidence. Instead of serving as a bulwark against misinformation, the CDC could become its distributor. It will be pressured to validate unscientific claims and back unscientific claims. Perhaps the most concerning consequence of the political control over public health messaging is the erosion of trust. Trust is the single most valuable asset that is available to the CDC during any health crisis. If the public believes that any information that is being filtered or is being manipulated, then compliance with health measures fails dramatically. During the height of the COVID-19 pandemic, surveys showed that the trust in the CDC and other institutions was already declining. Waning confidence that came from people expressing confusion about contradictory messaging, debates over masks, and shifting guidelines. Expressions of thought that highlight limitations in scientific and health literacy, but were expressed as guidelines and recommendations appearing to be politicized. That is, the populace's lack of scientific literacy skills and health literacy skills led to the implication that changes in guidelines, changes in understanding were a method of politicalization of the science rather than simply the shifting of the science. Going back to how those that wish to undermine the science will apply their politics to the science, instead of understanding the intent and inherent nature of science and scientific knowledge, that is an evolving situation that we find ourselves in. That is, those that wish to politicize science will use the uncertainty of science as a political messaging in order to erode trust in what is being presented by the health scientists. Now imagine a scenario in which the CDC is openly seen as bowing to RFK Jr., bowing to MAHA, bowing to MAGA, and their aligned viewpoints. Millions of Americans that already distrust RFK Jr. and the current administration's point of view about public health would immediately distrust any CDC recommendations, even if those recommendations are accurate, valid, and reliable. At the same time, those that support and openly support RFK Jr., MAHA, and MAGA might see the agency not as a neutral scientific body, but as one that allies with their ideological roots in an ideological battle, supporting any guidelines and any recommendations, regardless of the accuracies, reliability, or validity. In both cases, the CDC loses its credibility as an independent voice. If that credibility is lost, the ability for the CDC to offer policies that save lives gets lost. The CDC does not merely issue press releases. It affects real-world policy, how vaccines are distributed, what kinds of screening programs are recommended, how resources are allocated during outbreaks, and how local health systems are prepared for emergencies. Public health decisions have life and death consequences. When ideology dictates those decisions, preventable deaths become inevitable. If political pressures override scientific judgment, the wrong policies get implemented. We are already seeing this take place within campaigns against vaccinations. When the changing in vaccine campaigns, we are seeing a declining rate of vaccinations and a rise in preventable infectious disease and preventable infectious outbreaks. We are seeing it take effect right now. Changes in the flu and in CDC vaccination schedules and recommendations. CDC recommendations are getting altered to understate the importance of vaccines and fit with the biases of RFK Jr., the anti-vaxxers, and the MAHA agenda that is alive within this current administration. We are already seeing it with disease monitoring. Surveillance data is being manipulated or can be manipulated to show lower infection rates as what was wanted during the COVID-19 pandemic. Local governments might scale back interventions, might scale back local programs prematurely, and allow outbreaks to spiral as what we see going on with measles outbreaks right now. Changes in the resource allocations can become real. CDC prioritizes certain narratives, and those certain narratives will take root and become foundation for resource allocation based off of narratives, not based off of actual data. Resources will be misdirected. Resources may not be allocated or procured at all, leaving vulnerable populations to be exposed. What's more, when the institution is based on corrupting the science, good scientists won't want to work for the institution. An overlooked issue is what's happening inside the CDC itself. When political control ascends, scientific resources descend. We are seeing it right now. The ouster of the heads of the agencies. An agency that is staffed by tens of thousands of career scientists, epidemiologists, and health workers who dedicate their lives to public service are being undermined by political whims. Their work is being overridden by political messaging and is leading to morale plummeting. Talented researchers may leave the agency, recruitment's going to suffer, institutional memories are going to erode. With continuous political interference, there could be an accelerated brain drain from the CDC, leaving the US dangerously unprepared for the next public health crisis. Problematic as the CDC is not merely a domestic institution, but a global institution. Its influence reverberates worldwide. Global health agencies, developing nations, and international organizations often look to the CDC for guidance, data, and technical expertise. If the CDC is compromised, the ripple effects are global. Consider how the WHO, the World Health Organization, and the ministries of health in Africa, Latin America, or Asia might respond if they perceive the CDC's pronouncements are being politically filtered. Trust in US science is going to weaken, reducing cooperation and potentially weakening global pandemic preparedness. In a world where diseases spread across borders rapidly, where viruses do not respect the boundaries of countries, the undermining of the CDC has consequences far beyond the American country and far beyond American politics. Allowing political leaders to control the CDC sets a precedent that future administrations, regardless of party, may exploit. If one administration can force the CDC to align with its narrative, what's to stop the next? Public health then becomes not a matter of science, but a matter of political rotation. Each electoral cycle could bring new quote-unquote scientific truths that align with partisan goals. Such a precedent would be devastating. It would devastate the credibility of the US government. It would devastate the credibility of US scientific enterprise. Agencies like the FDA, the NIH, the EPA could be subjected to even greater manipulations. The long-term cost is the collapse of the public faith in science as an independent safeguard. Beyond the scientific and medical concerns lies the broader democratic principle, the balance between political accountability and expert independence. In a democracy, elected leaders should guide policy objectives, but expert institutions must retain independence to ensure that facts are facts, regardless of ideology. If RFK Jr. and the MAHA and MAGA aligned officials within the current administration succeed in bending the CDC towards their views, it signals that expertise is fully subordinate to political will. That is not just a threat to public health, it is a threat to democratic governance itself, because it normalizes the idea that truth is determined not by evidence, but by who holds power. What can we do? What do we need to do? We need to stand up. We need to speak out. We need to protect the CDC, not just from the onslaught from RFK Jr. and MAHA initiatives, but from political influence altogether. We need to make sure that the CDC is independent. We need to pressure Congress to strengthen the CDC's independence by creating legal firewalls that prevent political appointees from altering or censoring scientific reports or public health guidelines. We need transparency in the requirements. All communications between political officials and health agencies should be subject to disclosure, ensuring the public sees when pressure is being applied and how pressure is being applied. We need to strengthen whistleblower protections. We need to strengthen the protections for career scientists who are resistant to political interference and political influence, and encourage those to resist the undue pressure. But most importantly, we need stronger educational standards. We need to strengthen public education. We need a stronger effort to help the entire citizenry, the entire country, understand the difference between evolving science and political spin. We need to strengthen health literacy. We need to strengthen scientific literacy. We need to strengthen critical thinking throughout the educational system. That is the only way to reduce susceptibility to manipulation in messaging. The problem of RFK Jr. forcing the CDC to comply with his and the current administration's viewpoint is about far more than one personality or one administration. While it can, may, and will have long-term ramifications on our health, it is a test of how much independence science retains in the current hyperpolarized political climate. It is a question of whether we still believe in evidence as the foundation of healthcare and health policy, or whether we have resigned ourselves to living in a country where truth is decided by one person, expressed to the people in a press conference or in a campaign rally. The CDC's mission is too important to be subordinate to politics. When politicians and controversial figures attempt to control it, the consequences are predictable: less trust, weaker health outcomes, and poorer international cooperation. While a lot of pundits will talk about this as an undermining of democracy itself, it is much more than that. It's about undermining what we hold true, what it means to have objective facts, what it means to be healthy, and what it means to go about and become healthy. Part of what we've been doing with this podcast, part of what we've been doing with the Substack, part of what we've been doing with the YouTube, is trying to dispel misinterpretations that lead to the misinformation and disinformation. Part of that comes from very poor critical thinking skills and the wanting to subjectively dumb down the objective information. Oversimplification leads to faulty rationalizations. And that is what's taking place with this undermining here. We are allowing one person's bias to be reflective as all of our understanding of what is truth. Protecting the independence of our public health institutions is not a niche concern. It's the difference between a society that navigates crisis with resilience and one that succumbs to them. It's an indication of society that is reliant upon objective truths versus one that is reliant upon subjective wants. Thanks for listening. Hope we got a bit out of the discussion and conversation about the issues that might come into play when we allow the idiocracies to ruin our healthcare. If you have questions or comments, please make sure you leave it for us. We're more than happy to discuss them either in future discussions or in the written stuff on Substack. Please make sure you're following us here on the podcast as well as on YouTube. The written stuff in Substack, as well as the quick takes we post to Instagram and to Threads. Please stay tuned for future discussions about the misinformation and disinformation that we face about how the human body works and how we go about living a healthy lifestyle.